PSA stands for prostate-specific antigen. This is a protein that's produced in the prostate. There's a lot of PSA in the prostate, and the PSA is an enzyme and it has some function. The PSA by itself is not dangerous or not harmful. Some of that PSA will leak out into the bloodstream, and you can do a blood test and measure that. Any condition that affects the prostate can affect the PSA level. And the main conditions that affect the prostate are, number one, prostate cancer. Number two would be prostate enlargement. Men will experience a non-cancerous enlargement of the prostate as they get older, and that can cause a slow, gradual rise in PSA over time. A prostate infection or prostate inflammation or a urinary tract infection will also affect the PSA level and can cause quite dramatic increases in PSA, which will then correct after that infection or inflammation resolves. So the PSA is not specific for prostate cancer, but it is specific for the prostate gland. Well, we use the PSA primarily to diagnose and manage prostate cancer. PSA can be used in screening. PSA can be used to monitor treatment success or failure. So the PSA is a very valuable tool in urology, not only for diagnosis, but for treatment and follow-up. When PSA screening first became widespread, normal values of PSA were thought to be less than 4, and abnormal was greater than 4. We now realize that that's not accurate. And what we find now is that watching PSA over a period of time is much more valuable than any given number by itself. Because a typical prostate cancer, PSA would double in 2 years' time. Or if a PSA value increases by more than 0.75 a year, that could be a warning sign for prostate cancer. So the change in PSA is a much more valuable tool than the PSA by itself. We've also finding that even patients with low PSAs of 2 or 3, over time it can be at increased risk of prostate cancer, particularly if their PSAs are 2 or 3 at the age of between 40 and 50. Whereas a man that's 70, a PSA of 2 to 4 would be very low risk of developing prostate cancer at a later time. So the current recommendation is to get a PSA at age 40. And that PSA, at age 40, the PSA should be less than 1. Should be less than 0.7. If it's more than 1, that patient may need to be watched fairly closely. The watching would be having the patient come in on a somewhat scheduled basis for their PSA and the digital examination.